It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our first guest, Dr. Michelle Kauffman, primary care physician from Overlake Medical Clinic's Primary Care Issaquah. And it's just about back to school time. Some kids already getting to their college of choice, moving into dorms. Starting college, there are things to remember besides buying them a futon and a microwave and a TV. They've got to have some medical needs that are addressed as well, and that's what we're going to talk about today.
That's right. Yeah, exactly. We're going to talk about medical needs when you send your kids off to college, but don't forget the mini fridge, Tom.
Absolutely. Everybody's got to have one of those. Let's hear from Dr. Kauffman and Shannon O'Kelly.
Dr. Kauffman, welcome and good afternoon. How are you doing today?
I'm doing good. Thank you.
Thank you for joining us. Tell us about your job, your specialty. Tom talked about you being a family physician with Overlake Medical Center, but you have more of a role in that practice. You're one of the directors there, or you are the director, but tell us about your practice.
I am one of the directors there. So I work in the Issaquah Clinic, and I'm one of the only remaining founders of that clinic, but we've got a good team there. And recently, over the past year, I've gotten into the role of director of both the Issaquah Clinic, the Lake Hills Clinic, and the Sammamish Clinic. So I help lead the providers there and make things a better place for all of us.
That's fantastic. I mean, as a family practice physician, do you have an area of interest? I mean, do you have a specialty that you like within that broad spectrum of family medicine?
Sure. I think one of the reasons we go into family medicine is because we want to see it all. So I love seeing from the very newborns to as old as you get. And that's one of the great things about our job, because you can see anything that walks through the door. So I really like it all.
Absolutely. You know, it's amazing. And I was just thinking about this as I was thinking about doing this interview with you, because we're going to talk about sending our kids off to college. And you talk about seeing the newborn. It must be kind of a fantastic experience as a physician, particularly a family medicine physician, to watch a newborn come into your office and then all of a sudden help the family transition to college. It happens so fast, doesn't it?
It sure does. And, I know it's hard on the parent side, but even on my side, seeing these kids once, a couple times a year, it's just such a amazing thing to watch them grow and go into this huge transition in their life.
Let's talk about transitions. Let's talk about sending our kids to college. That's a big step. But there's also some medical concerns that we probably don't think about enough as parents. I know when I sent my kids to school, I knew they had a health center on campus, but that's really about it. But if your kids are going across country, 6 hours away by flight, you got to think about that kind of stuff. So how should we prepare to send our kids to college? We're talking about, things we hear at college campuses, breakouts of meningitis, measles, HPV. Let's talk about it as we prepare to send our kids to college.
Yeah, I think it's definitely a really good idea to have your family come in for an appointment before we send those kids off to wherever they're going. That way you can make sure if they're on any medicines, they have that, but also, like you said, the vaccines. There are breakouts of meningitis across the country. So there's actually a special vaccine for certain colleges because that one's not contained in the normal meningitis vaccine. So we really have to watch out for that. And if you're going to one of those specific areas, you need an additional vaccination to really protect you.
So we're vaccinated. I mean, normally as we grow up, we receive vaccinations on a regular basis. So what you're saying is, for the most part, we're vaccinated against the majority of meningitis or certain meningitis strains.
Right. Yeah, the normal meningitis vaccine protects you against 4 different types, but there's also an additional meningitis vaccine that protects you against an additional type that we need. It's called meningitis B, and it's needed for specific universities where there's been outbreaks.
Any ideas where those universities might be?
They're scattered across the country. A big one in the local area is Oregon State University.
Wow, interesting. I did not know that. See, this is why we do this radio show.
Right.
And meningitis, just to kind of review it from a standpoint of a disease or pathology, it's a bacterial infection. It's not a viral infection.
Correct.
And there's different strains of bacteria. And when these kids get in these dormitories and they start grouping up, that contagion or that bacteria can spread pretty quick.
Yeah, we're definitely at more risk just because of the dorm situation. You've got a lot of kids and we're all really clustered in there. And so you can really get some issues. It's best to protect before we go.
Yeah, I think it was about midway through the first semester when I finally did laundry. No,
if you remembered how, yes.
Yeah, exactly. But I'm just joking. You're 18 years old. You're going off to college. There's things you have to look into. And the vaccination is a one-time deal.
It's a one-time deal, so that's really good.
We're talking about kids going back to school, their medical needs, and we'll continue our conversation with Dr. Michelle Kauffman, primary care physician from Overlake Medical Clinic's Primary Care Issaquah, and Shannon O'Kelly, right after this timeout on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
We continue our conversation with Dr. Michelle Kauffman and Shannon O'Kelly.
Dr. Kauffman, again, thank you for joining us. We're talking about vaccinations or just preparing our kids to that transition, going off to college. Exciting time for everybody, particularly the young person. But medically, we have to think about some things. You talked about meningitis. I want to talk to you about this HPV, which is in the news a lot. I raised 4 kids, and I don't think any of my kids were ever vaccinated for it, but it's something we have to think about. Tell us about HPV.
Yeah, it's definitely one of the newer vaccines, but shown to be very, very effective. It protects against the most common types of HPV, which can cause cervical cancer, genital warts, even been linked to throat cancers and penile cancers. So it's something that can be really protective for children. It's best to give before children are even sexually active, but always good if you haven't had it to get it before you go to college.
Okay, so it's never too late to get it. I mean, sometimes you read where the young girls have to start at 12 or whatever. I've read where they start at young and boys, and it's a vaccination. It's a series of vaccinations. Am I correct there?
Correct. If you get it early on, it's 2 vaccines, but if you get it later on, it's 3 vaccines. And we can give it up till the age of 26, so it's something really good if you haven't gotten it before you go to college. We know some activities may occur, so best to get it done before you go.
And is that being recommended by family practice physicians more frequently now?
Definitely. Across the board, it's really highly recommended to be completed.
I'm sure it's in the paper all the time, but I know parents out there really don't understand it. But it's this virus. I'm gonna kind of summarize it a little bit. There's a virus that's out there, and it can be dormant. It's almost from the same family as a herpes simplex virus, or in that line.
Similar, yeah. It's called the human papilloma virus, and it's linked to some bad things. And really, this is one of the only vaccines we have that can actually prevent a cancer from occurring. So it's really worthwhile to look into and to get.
And if you have it and you get it, does it stay with you? Is it one of those viruses that stays with you all your life? And can you get rid of it? So once you have it, if you get the vaccination, is it going to take the virus and shut it down and eliminate it, or is it going to stay in your body?
The vaccine can help. It won't take rid of the virus you currently have, but it'll protect you from further strains of the virus. And your body it does amazing things. It can help clear the virus, but who knows if these effects have already taken course. And
this virus, HPV, I mean, let's talk about this because we have to. Like you said, there's some activities in college that occur, and this was sexual contact. I mean,
correct.
It really is. That's what it is. So,
yeah.
I mean, precautions, prevention, but vaccination, since it's out there, you should talk to your family practice physician about that before your child goes off to college.
Definitely. I mean, this doesn't excuse you from birth control or condom usage or any of those sorts of things, but it's one extra step you can take to protect yourself against some pretty serious consequences.
And do most insurances cover the vaccination then?
Yes. Yes, they do.
As we wrap up, again, great information. I hope parents are listening because I know I would have liked to heard this segment when I sent my kids to college. We didn't even think about it, right?
Right.
Is there anything else that we should think about as we go off to college?
Beyond vaccinations, it's just really important to follow up with your primary care doctor before you go because they can look into these things, see if there's outbreaks anywhere, or give you suggestions specific to your health about what you may need when you go off to college. So it's really important.
Once again, thank you for your time. Great information. Have a great afternoon.
You too. Thank you.
Very good information from Dr. Michelle Kauffman about starting college, what your students' medical needs should be. And I think that's probably a conversation every parent should have with their child before they go away to school, at least some basic medical knowledge.
Absolutely. I mean, again, there's so much out there, and if your kids are going across country, it's 6 hours away by flight. Like I said, long distances, you have to know what's going on campus, and you should get them vaccinated for everything. Why not? Vaccinations are out there, right?
Rachel Byrne is coming up next. We're talking about alternative pain management on Como.